Alright, y'all. Welcome back to my YouTube channel, CAC The Spotlight. And in this video presentation, we talking about rough sex and that morning after. Okay? Now, before I dive into the content, I have to tell you who this video is being created for. I have a certain target audience that I want to reach with the content in this video, okay? And that target audience is those of you in society living in the world and you are having unprotected sex with multiple people, okay? And you think that you can run immediately to the doctor the morning after a night of rough sex and be tested for HIV, and you can find out conclusively whether you are HIV positive or negative, okay? This video is aimed at you. You need to hear this, okay? In this video, I want to introduce you to this topic, HIV seroconversion, okay? Remember this, HIV seroconversion and acute HIV infection. Now, I want you to pay attention to these people here. You see these people here? Obviously, they're sick, okay? They are dealing with something that has caused them to become out of action, for lack of a better term at the moment. They are set the fuck down. They're sick. For some reason or another, they are resting, okay? Now, let's get into this. That term I just mentioned to you is called seroconversion. So in med terminology, seroconversion means the development of an antibody response to an infection or vaccine measurable in the serum. What the hell does that mean, okay? I'm gonna give it to you like this. You see this S-E-R-O, sero. That means blood. Sero. Conversion means change. Conversion, change, blood change. Changes from what, you might ask? It changes from HIV negative to HIV positive. If you look at the graphics I have here on the screen, you can see this person is undergoing an HIV test. They're collecting their blood, and that blood is being put into an HIV test kit. Now, once your body has launched that immune response to the infection, which is HIV, if you are infected indeed with HIV, your body must develop an immune response to the HIV in your system. Okay, now get this. Stay with me here. Stay with me. Stay with me. Now, if you run out to the doctor to have a test the morning after you've had unprotected sex with somebody who is HIV positive, you will not test positive yourself. You still will be negative. That is the purpose of this video, to bring it to your awareness that your body must go through this process of seroconversion. Your body must develop an antibody response to an infection, which is HIV, which will be measurable in the serum or the blood. Okay, I hope you're with me so far, okay? So remember that term, seroconversion. It is only after seroconversion that your HIV test will be 99% conclusive for the result, okay? Now, if you don't want to listen to me, listen to this person here who is much more intelligent than I am as they explain it to you, okay? Everything that I'm going to share with you right now, I'm going to link it down in the description section of this video, okay? So, yeah, I know sometimes it's hard for y'all to listen to a brother spitting facts, okay? But I'm doing this for y'all out there in the world who need to know this information, because we can do better when it comes to controlling the HIV epidemic and definitely preventing AIDS, okay? I'm passionate about this topic, okay? So I want to be quiet now. Here we go. Let's turn our attention to the presenter in this video, which will be linked down in the description section. Okay, let's go.
HIV antibodies. Seroconversion is the period during which these antibodies first become detectable. Most HIV tests check for the presence of HIV antibodies.
Get that? Most HIV tests check for the presence of antibodies. We just read it right there, people. Most HIV tests test for the presence of antibodies. What did we read here in this seroconversion? The development of an antibody response to an infection. Once you are infected with HIV, your body will have to develop antibodies. It's not going to happen in one day. But listen, I'm shutting up again and I'm putting it back on our presenter here in this YouTube video, which will be linked in the description, okay? I'm being quiet. Let's listen.
So, if a person who has contracted the virus takes a test before seroconversion begins, the result will usually be negative.
You get that? He just said that once a person contracts HIV, it takes about 8 days for the process of seroconversion to begin. So if you get a test immediately after you are or have contracted HIV, the results will usually be negative. Are you getting that? People, listen, I'm passionate about this because I'm tired of seeing my people die of HIV and AIDS. I'm tired of seeing it. So let's rewind this a little bit. Let my man speak again. Here we go.
Become detectable. Most HIV tests check for the presence of HIV antibodies. So, if a person who has contracted the virus takes a test before seroconversion begins,
there we go. It takes 8 days before seroconversion even begins. Get that? That's like, you can call it 1 week, but it definitely is not saying the morning after. This ain't your morning after pill. You know what I'm saying? This ain't that 72-hour fucking pill. It ain't that. It's something else.
Result will usually be negative. During seroconversion, a person may also experience flu-like symptoms such as a fever and body aches.
Did we hear that? During seroconversion, a person may experience flu-like symptoms. I'm highlighting this because if you out here fucking around, okay, and you are unprotected, and let's say one odd day out of the week, maybe after 2 weeks of fucking somebody brand new, and you get sick, and you feel like you got the flu, you might want to pause. You want to pause, back up, sit down for a minute, figure that shit out, because something's going on in your body. That might be that red flag, that warning sign, that alert. Like, sit down, bitch. Something wrong. This is going for men and women out there. If you fucking around unprotected and you get sick all of a sudden, sit the fuck down. Stop fucking people.
In this video, we discuss seroconversion and how it affects testing for HIV.
He just said how, discussing seroconversion and how it affects HIV. We gotta get this, how seroconversion affects testing for HIV.
How long does seroconversion take? The length of time between first contracting HIV and developing detectable antibodies can vary because everyone's immune system is different.
Get that? The length of time that you will have an accurate test for whether you are positive or not varies according to people, because everybody's immune system is different. Some people might test positive in 7 days or whatever. Other people may take as long as 90 days. Okay? Keep that in mind. That's a window period we got to keep in mind. Window period.
It can also depend on the type of HIV test that a person takes. Most HIV tests detect the presence of HIV antibodies.
Antibodies. My man has said it again. Antibodies. HIV tests are testing specifically for the antibodies that are produced by your immune system once it has encountered HIV.
People usually develop detectable antibodies within 3 to 12 weeks
3 to 12 weeks. People usually develop antibodies within 3 to 12 weeks.
of contracting HIV. Is HIV transmittable before seroconversion?
Here's a good point to mention. Is HIV transmittable before your body has went through this process of seroconverting? Is it? Think of it this way. Before you develop symptoms, before you have tested positive on a test, is it possible for you to transmit or infect the person you fucking with the HIV that is in your bloodstream before you are even unaware about your HIV status? Is it possible? Think of this.
A person can transmit HIV before seroconversion.
A person can. A person can transmit HIV before seroconversion. You know, this is why we got to talk about this virus, because there is so much information about HIV that needs to be shared and understood in order for people to better prepare themselves and stop this progression of HIV infection, okay, and stop this AIDS pandemic. People, you gotta know this. So I'm sharing this. And listen, before I go any further, if you are liking this content so far, hit the like button, share, subscribe, leave a comment, whatever you want to do. But the most important thing that you do for me, is hitting that like button, subscribing, and sharing this content with someone that you love. Those are the 3 most important things for me, okay? I'm shutting up now. Let's go.
Even when the immune system has not yet produced detectable amounts of HIV antibodies, the virus is still active.
Even once the immune system has not produced detectable amounts of HIV antibodies, the HIV virus is still active, yo. That's crazy. So if you are HIV infected with no symptoms, with no detectable antibodies, you are still a walking virus factory ready to go out here and infect someone else. Man, we got to be careful.
In the time between contracting the virus and seroconversion, most people do not know that they have HIV.
Get that? In that time between contracting HIV and seroconversion, most people don't even know that they have it. Man, this is one wicked ass virus, yo. Man, this is like that Batman. You know what? This is like that Batman. In Flint, Michigan, in our hood, people call it the Batman because that shit just sneak up on you and swoop down and take you out. The Batman. Yeah.
If they take a test, the result will likely be negative.
Get that? Before seroconversion has completed, the result will likely be negative, man.
Anyone concerned about HIV exposure should speak to a healthcare provider. Symptoms during seroconversion. When the body is first producing detectable levels of HIV antibodies, people often experience symptoms.
Get that? When you are, listen, I want you to hear this again. When people are experiencing seroconversion or going through seroconversion, you will experience symptoms. Now, I want you to pay attention to these symptoms he's going to list. I'm going to back it up a little bit here, okay? Hopefully, we don't get no more damn ads, okay?
Symptoms during seroconversion. When the body is first producing detectable levels of HIV antibodies, people often experience symptoms similar to those of the flu or other viral infections.
Symptoms similar to those of the flu or other viral infections, okay? Now, I'm going to interject this. This is why a lot of people, when they become infected with HIV and they become sick and they're going through seroconversion, they, what's the word? They kind of they downplay those symptoms as to being something less severe than HIV, right? Because these symptoms they mimic those of the flu or other viral infections. So yeah, man, we got to know this, people.
Symptoms of seroconversion may include fatigue, fever, a sore throat, a headache, body
Fatigue, fever, sore throat, body aches,
aches, swollen lymph nodes,
swollen lymph nodes,
swollen tonsils,
swollen
a
tonsils,
rash,
ear rash. Did he say ear rash? Earache? I think he said earache, but my man obviously is not a native English speaker. But we can be graceful with him. I think he said earache or try to say earache, whatever.
These symptoms can also appear during the earliest stage of HIV infection, which is called the acute stage. The symptoms occur because the immune system is mounting an attack against the virus.
Yeah, so my man, he just said here that these symptoms also can occur during the acute infection stage of HIV because your body's immune system is launching an attack against HIV.
Symptoms usually last for around 14 days, but they can last for months.
Usually the symptom lasts for 14 days, but they can persist for several months, is what he said.
Some people experience no symptoms during the initial stage of infection.
Some people experience no symptoms, right?
Testing for HIV. HIV testing is crucial because it can lead to earlier detection and treatment and less risk of transmission. The only way for someone to know for sure whether they have HIV is to take a test. Some people may not be aware that they have contracted the virus because HIV infections do not always produce symptoms. Authors of a 2016 study concluded that expanding screening criteria to include a broader range of signs and symptoms, such as those listed above, may increase the amount of acute HIV infection diagnosis, which will ultimately advance prevention and treatment strategies. The Centers for Disease Control and Prevention recommend that everyone between the ages of 13 to 64 years old.
Get that. He said the CDC recommends that everyone between the ages of 13 and 64 gets tested for HIV. Ain't that some shit? 13 to 64. Man, that's a huge fucking range of people out here fucking. Yeah, you got to be careful, man, because you got 13-year-olds out here getting it down, right? 13. Still babies, man. Babies. And then you got grandmas, grandpas out here ass clapping.
Take at least one HIV test as a routine part of their medical care. The accuracy of HIV test has improved significantly since scientists first identified the virus. However, no test can accurately detect HIV immediately after a person contracts the virus.
No test can accurately give positive results after the person has contracted the virus. Immediately after contracting the virus, okay? And that is the whole purpose of this video, yo. This is to say that if you had sex with someone who was HIV positive on Monday, August the 27th, you cannot go to your doctor on Tuesday, August the 28th, and get an accurate result of what your HIV status truly is. So with that being said, people, we've got to remember that your body has to go through this thing here, HIV seroconversion. And during seroconversion, your body will have certain symptoms that it will show Okay, HIV will manifest itself through certain symptoms. Okay, and again, this med term is seroconversion, which means that your blood is changing from HIV negative to HIV positive, because your body has produced this antibody response to HIV, which is the infection. Okay, and the last thing I want you to know is that there are preventative measures to prevent becoming infected with HIV to begin with. And there's condoms, PrEP, HIV testing, okay? And if you do become HIV positive, there's treatment for you, okay? There's treatment for you. So, but saying all of this is that in this 2022, people, we black people especially, we have got to become more responsible and take control of our lives and do what it is that scientists have shown to us to be effective in combating this goddamn virus known as HIV. I believe in you, so you believe in me. Hit the like, subscribe, comment, share, and get this message out there, okay? This has been CAC in the Spotlight. I'm out. Deuces. Peace.